It's time for Pain-Free Living with Dr. Mitchell Yass and the Yass Method for Pain-Free Movement on 1010XL. Here's Matt Hayes.
Happy Sunday, Jacksonville. Welcome to the fourth installment of the Pain-Free Living Hour with the Dr. Yass. Dr. Yass, we're going to be opening up the show today with 8 notable knee facts. So if you happen to be in need of a new knee, luckily enough for you, Dr. Y, again, has 8 notable knee facts. And we're kicking off the show with number 1. Dr. Y, let's start the show.
Just wanted to say we're not quite sure where Matt is. He seems to be indisposed, so we're just going to run through the show. You're going to be taking his part, and we're going to go from there.
Let's make it happen.
All right, man. So good Sunday morning to everybody listening. Again, just to make the point, if in fact you're having issues with your knee or any other part, please don't hesitate to call in to ask a question, to get some guidance, and help you be able to become pain-free in just weeks. So this is a mind-blowing show, folks. I'm going to give you 8 notable knee facts you have never, ever heard before, and it will help you to understand what is causing your pain. And if, in fact, you come to the realization that the cause is, in fact, muscular, you will see that your pain can be resolved in just weeks, and you can reclaim your life.
Now, Dr. Y, you're always saying this week in and week out. Push it. When you're saying it is not in fact what doctors are telling us. It is in fact the studying, everything that you have come up with through how many years of this?
This is now almost over 30 years I've been treating based on this method.
Okay, before we get into the 8 notable, 904-641-1010. Again, 904-641-1010. We are talking knees today, but any type of pain that is limiting your life, Dr. Y has an answer for. So with that being said, let's get going. 904-641-1010. Any question you have, call in. 904-641-1010. Number 1 notable knee fact, Dr. Y, take it away.
So I think these are so important, so unique, that I need to create an alarm, an awareness.
You need. There it is.
Very good.
Let's go.
Alarm. So here is your alarm. When that comes on, I want you to realize what I'm about to say will blow your mind. It is revolutionary information. So number 1, the knee joint is actually 2 joints.
So the knee joint is 2 joints.
That is correct.
So that's 2 rings of the bell.
2 rings of the
Let's
bell.
hear it.
Here we go.
Here we go. All right, so if you're hearing this in your head, 2 knee joints.
Right.
One of the 2 could have any type of problem whatsoever.
Right.
Take it away.
So here's the 2 joints. The joint that most people know about is the joint between the thigh bone and lower leg bone. But there is another joint, and that is the kneecap and the thigh bone. So I just want to briefly explain why you have two joints. No other joint has 2 parts to it, okay? The first part of that joint, the joint between the thigh bone and lower leg bone, that's where range of motion occurs. So if you want to bend down to the floor or kneel or something like that, range of motion occurs there, okay? That's the joint between the thigh bone and lower leg bone. But the joint between the kneecap and thigh bone, that's where force development occurs that allows you to control yourself down, to bend your knee, to climb stairs, to sit down. So one joint is where range of motion occurs. The other is where the force development occurs for either weight bearing, range of motion, or function. So you could have pain in one location and it be completely independent of the other joint.
But the 2 joints work hand in hand.
Correct.
Okay, got it.
But the important thing to understand is one is where range of motion occurs. The other is where force development occurs to allow function to occur.
Gotcha. So that is the number 1 thing we need to know.
Absolutely. There are 2 joints, and you may have pain in one, and the other cannot create pain there.
Okay, what's number 2?
Number 2, another.
You hear
Alert.
that going off, people?
This is an alert. Okay.
Pay attention.
Meniscal tears and arthritis occur at the joint between the thigh bone and lower leg bone. I'll say
Repeat that. Repeat that.
meniscal tears, these things that are being found on the MRI, are found at the joint between the thigh bone and lower leg bone. So, if you have pain at the joint of the kneecap and the thigh bone, the pain around your kneecap, you must understand that is an independent joint, and any structural abnormality at one joint cannot create pain at another. So the best way to understand this is, let's say, Rob, you have pain at your elbow, and I was to take an x-ray and find arthritis at your ankle, and I was to say to you, well, Rob, the reason you're having pain at your elbow is because of arthritis at the ankle, you'd say, that's insane. That doesn't make any sense.
Not at all.
Right. So the idea that a meniscal tear or arthritis at the joint between the thigh bone and lower leg bone creating pain around the kneecap simply can't exist. Okay?
Yes, absolutely. Number 3.
Okay.
Let's hear it. There it is. Number 3.
These are home runs. I don't think most people have ever heard this stuff. That's why I think it's so important that we alert them to how important this information is.
And that's exactly what we're doing right now.
Okay.
Hit us number 3.
Number 3, structural deficits affect range of motion, sometimes pain, but fewer times not. So we just mentioned that at that thigh bone and lower leg bone, that joint,
The 2 joints.
right? This is the first joint.
This is the
right?
first. Okay.
Right. There's the
gotcha.
joint between the thigh bone and lower leg bone.
Yes, sir.
And then there's the joint between the kneecap and the thigh bone. Right. The joint between the lower leg and thigh bone, lower leg and thigh bone, or thigh bone and lower leg bone. That's where the range of motion occurs.
Gotcha.
So if you had an arthritic change, if you had some sort of meniscal tear, what you could expect is some sort of loss of range of motion. It's not necessarily you have pain, therefore I have arthritis or a meniscal tear. The indicator, as I talk about, the presentation that tissue in distress is trying to show you is that if the meniscal tear exists or the arthritis exists, it's trying to say to you, you could identify me by seeing that you have a loss of range of motion, not pain. Pain is not the indicator.
So is this like the first the first kind of wave of, hey, I might have a knee problem? This is like something that's kind of the alerting you. Hey,
Correct.
Okay.
Correct. So remember, what are symptoms? What are symptoms? What is a sneeze, a cough? What is palpitation of the heart? They are indicators from a tissue that's not functioning properly, trying to let you know that is the tissue, and therefore specific symptoms are created by specific tissues.
Which is exactly what you're saying.
Correct. That is
right
the
now.
basis of the method. So we need to interpret the symptoms. What is the body trying to tell you? I am trying to guess what tissue is creating that symptom so that I can provide the proper intervention to resolve the distress of that tissue. It's through the interpretation of symptoms that we can understand this. So that is an important point, that if you have a structural variation, a meniscal tear or arthritis, you could expect to see a loss of range of motion if, in fact, it is also the cause of your pain.
Okay, number 4, Dr. Y. What do we got?
Here we go.
I hear it.
Big alert, big alert. Pain around the kneecap is almost always muscular.
Is always almost.
Muscular.
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 Which is exactly what you've been saying this entire time.
Correct.
Muscular, muscular, muscular.
Pain around the kneecap. Why? Why is it mostly muscular?
Tell me.
What is the purpose of that joint? It is where force creation occurs from the quadricep muscle to the kneecap, down to the lower leg, to allow either you to kick your leg out, to weight bear, or to perform functional activity. So if you're having pain at the kneecap area, you could expect there's some sort of force variation. Something about the normal distribution of muscle through that joint is not proper. So although you're having pain at the knee joint, the cause is a muscular deficit. This is huge. This requires multiple bell alerts.
I was going to say, of all the ones you've talked about so far, this sounds the most important.
Absolutely.
Okay.
Because it happens to be where most people who have quote-unquote knee pain are experiencing their knee pain. They are not experiencing it at the joint between the thigh bone and lower leg bone. They are feeling it at the joint of the kneecap to the thigh bone, right around the kneecap. Okay, number 5. Here's another big one. Lots of tendons attached near the knee. So just because you have pain in your knee region doesn't mean it's coming from the joint. It could be, in fact, a strained muscle creating pain through its tendinous attachment near the knee joint.
Layman's term on that.
So basically, you could have strained a muscle, and where it attaches to the knee or knee region, that's where you're experiencing your pain.
Boom.
Yeah, absolutely.
That only makes sense.
Absolutely, it makes sense.
Now, there's no rhyme or reason for it to be anything other than what you're saying at number 5, right? What you're telling me is, I've got something wrong with my knee. I don't know what it is. You're labeling it as muscular.
Based on what your body is showing me, because that's the only way. And what it's showing me is coming from the tissue in distress. In 98% of cases I've treated over 30 years, that has shown me that the cause is muscular. And I've treated it, and people have been out of pain in weeks.
Which, once again, just to push this further, Dr. Y, what you're telling us, the doctors provide an answer that is strictly surgery. What you're telling me is, if it's muscular, more often than not, especially with the knee, you have an answer for it.
And the answer relating to that is the fact that there are 2 languages that are going on. The existing language that says diagnostic testing can give me the answer as to the cause.
Which is the old school way.
And my way of looking at things, my language is that the body is trying to tell me something, and my responsibility is to interpret what that body's telling me. And I have found in 30 years that in more than 98% of cases, the cause is muscular.
Not just diving knee first with a scalpel.
Correct.
Exactly. Number 6.
Okay. Pain with weight bearing is muscular. So if you're weight bearing and you're having pain, and then you sit down and you don't have pain, you have to assume it's muscular. I'll give that just a small one.
Because that makes sense, right?
Absolutely.
You're sitting down, my knee hurts.
If you're standing and moving, it hurts, but then as soon as you sit down, it goes away. Well, you stopped using your muscles. So it kind of shows that it's probably muscular.
I guarantee you there are plenty of people out there that are ignoring the kneecap, that are ignoring, when I sit down, I'm okay. As you're saying, yeah, but the thing is you're not using it. If you're not using it, you're going to lose it.
The confusion for most people is that the pain is at the joint, and by nature, you assume that the structure of the joint must be the cause, when in fact, muscles control joint position. And so if you're having pain with weight bearing, at a joint, and then it stops as soon as you sit, you have to assume it's the muscle.
Slow it down a little bit, because I believe what you're saying is very pivotal with what we are trying to achieve on this show. Again, this being the 4th installment, you keep using the same vocabulary with what we're saying with muscular people. You don't need the surgery.
Absolutely.
You need Dr. Y.
Based on the presentation of symptoms. That's my point.
And you've been doing this for over 30 years.
30 years. I've treated multiple thousands of people. Absolutely, based on this system.
Let's go number 8. Let's cut the commercial, my friend.
Okay. We're going to go to commercial?
After number 8.
Okay. Pain post-surgery is still correctable. This is a huge one.
That's huge.
For all those people who have had surgery and are still having pain, ladies and gentlemen, that is not the end. It still could have been muscular. Even after the surgery, it's still muscular. It could still be corrected in just weeks with targeted strength training as part of the Yass method.
Real quick, Dr. Y, do you have patients coming to see you after surgery?
Oh, I would actually say the majority of them
is.
Are after surgery, because that is the standard of care that most people think is the way to go. And after it fails, they're still looking for options, how to resolve it. So that's when they find me.
And with the quote-unquote correctional surgery that they have had, you're still able to take these people in and make them better?
Well, remember, even if the surgery was done at a structure of the thigh and lower leg bone, if that pain was still around the kneecap, it was still muscular. That never changed. The surgery didn't change its cause or where the person's experiencing it, so it can be resolved.
Which, how often do you hear that? Like, hey, I had the surgery. I'm still having knee problems. How often do you hear that? Well, maybe not just the knee, but maybe back, whatever, shoulder.
The majority of people I've treated, I have to say, over 30 years, are post-surgical patients.
You hear that, people?
Yeah.
You had surgery. You were still able to be pain-free. Call in 904-641-1010. Dr. Y is here to answer all your questions. We are going to cut to commercial. When we come back, a patient testimonial. Somebody that Dr. Y has cured right after this. Welcome back to the pain-free living hour with Dr. Yass. Dr. Y, this is a fun fact about me you might not know. I got a journalism degree because I was horrible at math. It looks as if we only got through 7 of the 8. Let's get through that last one real quick before we jump on the caller. Dr. Y, take it away.
All right, thanks for that. So the final notable knee fact is the fact that pain at the knee can come from hip muscle weakness. This one's a big one. You need that alarm. So you're having pain at the inner knee. You notice that if you try to single leg stand, you're trying to walk, your balance is off. The reason you're having pain at that knee is because a muscle at the hip region, which is responsible for balance and stability, is not doing its job. So when you go to weight bear, your knee is caving in. It's not holding your knee under your hip. And as a result of that, there's an excess force load being created at the inside of the knee, and that could lead to muscles that attach at the inner knee to have to overwork and strain. So although you're having pain at your inner knee, and you could treat it all you want at that area, the cause is actually weakness of the hip region musculature. And again, the Yass method, through its interpretation of what the body's telling us, would help us understand that and help you to realize that to resolve that inner knee pain, you're going to have to be doing work at the hip region.
So in a wacky way, you're telling me the knee bone is connected to the hip bone, is that correct?
Absolutely,
There
and the
we
knee
go.
muscle is connected to the hip muscle.
That's right. All muscles, all muscles. With that being said, guys, we have our patient testimonial. Paul's on the phone. Paul, how are we doing today, my friend?
Oh, man, we're doing great. I got in late from a rugby game yesterday, so today's just kind of recovery and relaxing. So.
Oh, Paul, man, thank you so much for calling in. I appreciate it. I think your story is so unique in the sense of the relationship between the existing concept of how to address knee pain versus mine. And so if you don't mind, could you just tell people how you came about finding me and what exactly happened?
Yeah, absolutely. Thanks so much for having me on. First off, a little bit of background about myself. Firefighter for about 10 years now. Previous about 3-year competitive Olympic weightlifting, and so pretty extensive lifestyle. Still very active in the gym, obviously playing in sports. But probably about, I want to say approximately 3 years ago, if I had to guess, maybe 2 years ago, I started having some real bad knee pain. And I say bad knee pain. It started just kind of bothering me, right? And I mostly would feel it whenever I would step like on stairs, if I would lunge, if I squat, any of that, it would start bothering me. Kind of right there at the top of my knee area, kind of where the quad meets the knee. And and I did what I had a little bit of knowledge. So, I iced it, ice fasted it, put some, cream on it, stretched it. To my knowledge, I was stretching. I would rest it, the old rice method. And, it got progressively worse over the course of a couple of years. And what was really odd and strange to me was there was no injury, right? There was no one incident that happened that hurt my knee. I didn't damage it in any way. It was just this progressive ache that got really bad into pain. And if I just kind of gutted through it and did like a heavy squat session or something like that, it just hurt me for 3 or 4 days, and it let up, and then I'd deal with it, gut through it again, right? So anyway, it got to the point where it got too bad that I couldn't handle it anymore. It was affecting my work. It was affecting my time in the gym and things like that. So first thing I did was I went to an orthopedic doctor over here where I live at, and he took a look, took some x-rays, MRIs. Nothing came back out of the ordinary according to him, so he decided to give me some injections to see if it would help. And I was fine with that. Sure, maybe there's something going on he can't see or whatnot, or maybe he was just trying to take a shot in the dark, but an injection's not too big of a deal. So shot me, and it lasted maybe a week or so, and then we were right back to normal. And So I went back to him on my like follow up a month or two later, and he was like, "Hey man, we checked you out. We looked at you. Just didn't work. I'm afraid the only thing that what I could see is he told me that whenever I set my leg up, my patella was not lined up where it's supposed to be, essentially in the medial part of my leg. And he told me it was sitting more lateral than it should be, so it'd have to do what they call a lateral release, which essentially would just cut me on the inside, cut me on both sides of my patella, slide my knee over, and it would be in alignment, therefore would fix the problem. Of course, I'm like, okay, well, I guess that's what it takes, right? And this is going to be on, keep in mind, both knees, right? So it would be one knee, 6 months to a year later, the other knee. So I was in the gym one day, and the gym owner came up to me and goes, "Hey, have you heard of this guy, Dr. Yass?" I said, "No, I haven't." I said, "What's he about?" And he told me, and he had seen him for a couple things, I think, Dr. Yass.
Absolutely.
I think Doug had seen you for a couple things.
Yep.
Ray had seen you for a couple things. And I remember years ago, I saw you for a shoulder thing whenever you were doing sessions in the gym. It was like years ago, and I and not no disrespect to you at all. I had you were completely out of sight, out of mind at that point, right? Because it was so long ago. I saw you for a shoulder issue. So I said, okay, well, let me go see this guy, and I might as well. I had scheduled surgery for like a week or so later, maybe after the doctor told me I needed surgery. I said, I'll tell you what, I'm going to go see Dr. Yass the day before my surgery. I did not want to get surgery because I was going to be out of work for a while. And at my age, at 36 years old, like, who could even fathom knee surgery without any injury? Like, again, like I said before, I didn't injure it. I didn't hurt it in any way. It was really disheartening to think I was about to go under the knife. So anyway, went and visited Dr. Yass, went to his office, went in there, told him what was going on. And within 5 minutes, I'll never forget it because I tell the story all the time. It was 5 minutes of him looking and had me do like three things. I think he had me squat. I think he had me sit down and stand up. And there was one other thing. He goes, and I'll be more politically correct on this. He goes, "Your knee's fine." He just looked right at me dead and said, "Your knee's fine." I'm like, "What do you mean?" "There's nothing wrong with your knee." He's like, "Look, you give me full flexion, you give me full extension, you can squat, you can sit down, you can run." I'm like, "Well, okay, what the heck's going on then?" And in a nutshell, and Dr. Yass, you could fill in the blanks for this, but in a nutshell, it was simply that my quadriceps were way stronger than my hamstrings, which over time my quads shortened, which then was pulling on the patella of my knee. So whenever I would squat, I would lunge, I would bike, I would do anything. Whenever I hit that 90-degree angle, it would basically just pull my knee into the joint and cause pain. And he gave me some prescribed exercises, and I'll never forget this too. And it kind of made me feel like I didn't know what the heck I was talking about as a trainer and an athletic background. He told me to do straight leg deadlifts. And I'm like, "Well, I do deadlifts all the time." He's like, "Are you doing straight leg deadlifts?" And I'm like, "No." He's like, "Well, when you do a regular deadlift, you're hitting your quadricep and your hamstring." And it clicked. And I couldn't believe it. But whenever I look back at my workout regimens over the past, 10 years, there was almost little to no isolated, heavy loaded hamstring work.
So, Paul,
And,
just a quick question for you. So, how long has it been since I identified that you have been doing the exercise I asked you to do and not had knee pain and full function, by the way? How long has it been now?
I was looking back at my calendar before I called in, and I think I saw you for my knee pain. I want to say maybe 6 to 8 months ago, if I had to. Does that sound about right?
Right. I think it's at least 6, 8, maybe even 10 months since I saw you that time. And the important thing to understand there is the fact that the way I was able, what basically happened was, if in fact what his knee joint was trying to tell me was the fact that his kneecap wasn't tracking, it didn't matter whether he was weight bearing. It didn't matter if he was sitting and bringing his knee, his lower leg towards the back of his thigh and hyperbending his knee. That knee would have caused pain if, in fact, it was a tracking problem. The tracking problem would have told me that. But that's exactly what we did. I had him lay down and literally had him bring his knee to his chest with his lower leg on the back of his thigh. You can't bend your knee anymore, and he had no pain whatsoever. So that told me that the idea that the tissue in distress was the kneecap not tracking properly had to be ended. So he kept telling me that it related to weight bearing. If I tried to weight bear down and squat, weight bear down and lunge, that was his problem. And what was one of the lessons I just told you? If it's in fact muscular, you're going to have pain with the activity, but you're not going to have it as soon as you rest. And that was exactly Paul's description. So literally what happened was, before I even did exercise, I laid Paul down and I massaged his quads and stretched his quads. And Paul, how did that make you feel when I massaged it and stretched it and you stood up? What was your feeling?
Oh man, whenever I remember, and bear in mind when he says massage, that's a very light word for what is going on, right? It's more like release, but it's just always great. But yeah, as soon as you massage that thing and you did a proper stretch on my quad and actually lengthened it, man, I could have sat there all day and squatted, lunged, no pain, no problems. It was like what just happened, right? What voodoo witchcraft is this that I didn't know anything about, right?
In fact, Paul, wouldn't you say that you couldn't even remotely break a 90-degree squat or a lunge, and that upon completing that massage and stretch, you were able to go into a deep squat with your butt on your heel?
Oh yeah, absolutely. Like I couldn't even. I remember. I mean, my quad, I guess, was so shortened or so tight, I couldn't even bend to a 45 just to kind of do some knee circles and like warm my knees up. Like it just, yeah. To 90 degrees was just screaming pain, and below that was, on borderline unbearable. But as soon as you did that, butt all the way down to the back of my calves was like no problem at all. Nothing, no issues.
Paul, this is a two-part question. So you go to see Dr. Y, and he tells you your knee is fine. What is your initial reaction to him telling you? Again, as you were saying, you were prepared to get the surgery and everything. You go and see Dr. Y, and he goes, "Oh no, your knee is fine." What are you thinking?
I'm thinking, okay, what does this guy know that I don't? Or not to say that I'm the smartest guy in the world, but what does this guy know that this doctor doesn't? Like, then why? Why am I hurting? Was like, if my knee's fine, why am I hurting? That was so I was a sponge at that point, right? Mm-hmm. Like, tell me why my knee is hurting with my knee being fine. And I was ready to just soak it in. So at that point, I became almost a student,
Right. And you were listening, and you were, like you were saying, absorbing all the information that Dr. Y is telling you. So Dr. Y lays you down, you get up, you're able to squat. Now what are you thinking? What is your thought process? I mean, just 24 hours prior, you're thinking about surgery. You're then going into an office. You're being told your knee is fine. And then here you are doing simple exercises, and you're able to squat again. What are you thinking?
I'm thinking that the knowledge base that Dr. Y has of the human body and how it moves and how it works is well beyond any orthopedic surgeon or chiropractic doctor or any specialized doctor, because I feel like they just go off of images and just like a certain protocol, right? Like
right. X-rays, whatnot.
X-rays, MRIs, and what the patient's giving them, and that's it. And just the sheer humbleness that it gave me of like, okay, I need to look. There's way more to this to the body than I even remotely can touch. And to think that it was something as simple as, oh yeah, you got a tight muscle that's causing all this pain. lengthen it up and get the other one stronger about opposing muscles. It was mind-blowing, and it was absolutely humbling, and it opened my eyes to treating, looking at my clients that I might have and moving them differently and trying, not diagnosing it all by any means, because I send people to Dr. Yass or to other people, but yeah, it's really hard to describe. It's funny you asked that. It's just mind-blowing, really, really is all is what the best way to put it.
So, Paul, I believe you told me, didn't you cancel that surgery that day?
Yes, sir. I left your office. I called the doctor's office I was going to go to. I said, hey, I'm going to do this physical therapy that I have for, I think you told me to do it for 3 months. I said, I'm going to give 90 days. I'm going to give it 100%, 90 days. That way I know if it works or not. And told them that I'll reschedule if I need to. And shoot, it wasn't even a month. Like 30 days into the physical therapy that regimen that you gave me, I was like, nope, not going to need them anymore. So
great. And one other thing. So now that you've seen this, that you could have pain at a joint, and in fact it not be coming from the joint structure, but muscle imparting symptoms or stresses on the joint to create the pain. What would you say to anybody out there who's having knee pain, who's really kind of just looking for an answer, in terms of the two languages of diagnostics through diagnostic testing versus the interpretation of symptoms? Which do you think has a better chance of coming to the real conclusion? What would your opinion be, and what would you say to somebody?
Well, as you already know, I've already sent 2 or 3 people. The first thing people say, man, I get this going on. I'm like, hey, you can go see this guy, Dr. Yass. But I actually had a guy the other day at my job, and he was like, holy cow, my lower back's killing me recently. And I remember I came to you recently for that, and I couldn't figure out why. And I was like, hey, man, I went and saw Dr. Yass for the same thing. Basically, the hip flexor was just getting locked down, right? We talked about why I was getting locked down. And I was like, hey, man, for electric hip flexor, stretch it out, see if that helps. But go see Dr. Yass.
I appreciate you coming on and telling the story. And I just think you're just such a good example of when you put the two languages together, which one has the better chance of bringing you to the point of not just not having pain, but actually allowing you to live the life you so justly deserve. So thank you for coming on, Paul. I really, really appreciate it.
Thank you guys for having me, and thank you so much, Dr. Yass, for helping me out over these years.
You're welcome. Thanks for coming on.
All right, guys, take care.
Paul, thank you so much. With that being said, guys, Pain-Free Living Hour with Dr. Yass. You're hearing it. Give us a call, 904-641-1010. We're talking knees. We can talk any type of pain. Dr. Yass has got the answer for you. Again, 904-641-1010. Give us a call. We'll be right back after these breaks.
All right, it's the Pain-Free Living Hour with Dr. Mitchell Yass. Now, we told you as we were getting this flight, this maiden voyage off the ground, once you started figuring it out, we were going to start taking calls. We're going to start taking calls now at 904-641-1010. You got any questions, any pain questions for Dr. Yass, give us a call. Let's go to Barry. Barry's calling in for Dr. Yass. Barry, good morning.
Good morning, gentlemen.
Good to hear from you, Barry. What do you got going on?
Well, I'll be very brief. I have had x-rays multiple times on both knees over the last few years, and both knees are bone on bone. And I am scheduled for surgery on the 28th. I've investigated the stem cell stuff and other things that are alternatives to surgery, but I'm still not convinced that, unfortunately, the knee replacement is the appropriate action. And secondly, and last question, because of these alternatives that are available, why aren't they covered by insurance?
Well, as for the second question, that I can't answer. I have no control over stuff like that. in terms of your first question, number one, the first question you have to ask is, where's your pain? The knee joint is as I've described this entire show, is comprised of two joints. Is your pain at the joint between the thigh bone and lower leg bone, or is it around your kneecap?
It's around the kneecap.
Okay, so if it's around the kneecap, how could a structure of one joint be creating pain at another joint? Just like I said to Rob, you can't accept the idea that arthritis at the ankle can cause elbow pain. So I just don't understand how we could accept this idea. And by the way, let's be clear. I am not denying that you don't have some arthritic change. No one's going to deny that. But the question is that arthritic change creating your pain? That's all you care about. And so we want to understand, what is your body trying to tell us? What is the tissue creating that symptom so we could address it properly? And as I described, in most cases, if you have pain around the kneecap, you have to assume it's probably muscular. And my suspicion is no one's described that idea to you before. Is that true?
Pretty much, yes.
Okay.
I've had a relationship with an orthopedic surgeon since the mid-'90s. I have a lot of confidence in him, and we've talked in great detail about knee replacements and alternatives. And based on his research and so forth, he feels that if I want to fix this and I want to fix it for good, I need to have the knee replaced.
So here's a simple thing I could say to you, Barry. If it would turned out I'm right, let's just say, crazy concept, I'm right, and it's basically your quads are too strong a relationship to your hamstrings, and they're pulling excessively on the kneecap. I could basically show you that that's the cause in probably 15, 20 minutes. And if, in fact, that was true, and we did some exercise and resolved your pain, which would you choose? Doing a couple of exercises or the potential of getting a knee replacement and seeing where it goes? I mean, you sound like you're being somewhat hesitant in your desire to get that knee replacement. So I'm really just posing the question to you.
I don't think anybody looks forward to doing something like that, but I've been dealing with this issue for several years now. I've had, the doctor says I have the worst looking knees he's ever seen on a x-ray, and I'm 81 years old. And I really want to get rid of this and start being able to walk normally and do other things. So anyway.
So again, I would just go to this one more question for you. Does your pain worsen with, say, stair climbing, kneeling, bending, standing for prolonged periods of time? And as soon as you sit, does it seem to reduce? Does it seem to decrease?
Yes.
So if you would then acknowledge that weight bearing seems to be the trigger for your pain, and weight bearing is the resultant of muscular force, the ability of muscles to allow you to weight bear, and they happen to attach to the kneecap. So if it was the bone on bone, the actual process of bone on bone, wouldn't you kind of expect your pain to be like kind of constant at a somewhat standard intensity if it's always the bone on bone?
Well, when you're not moving or sitting or sedentary, I wouldn't think it would continue.
But the
pain.
But if, in fact, the process of being bone on bone, that's what you're being told, the process of bone on bone is causing your pain, that process doesn't stop and go. It's constant. So, therefore, you would expect the pain to be constant. But if it's primarily associated with weight bearing, again, I can only talk from my 30 years experience treating thousands of people, a very high percentage of them scheduled for joint replacement. I have been able to show that their body's presentation told me that the cause was muscular, and that, in fact, with a couple of targeted exercises, I had them out of pain in weeks. So my question to you is it worth the investigation? That would be the only point I would make to you.
Sure, I would think so.
Okay.
Have you ever indicated when someone comes to you that you finally say, well, it looks like you're going to need the knee replacement?
That is such an awesome question. So I have treated probably 16, 17,000 people, thousands of them scheduled for joint replacement. The number of people I have treated who I actually referred for joint replacement was 2. 2 out of thousands. 2.
Barry, I think you need to go see Dr. Y.
Well, I may just do that, and I appreciate the comments and the advice. So You guys have a great day.
All right, Barry. Again, 904-641-1010. If you want to get a hold of Dr. Yass, if you're Barry, if you're anyone else, 904-906-YASS. You want to schedule online. Live Without Pains, plural. livewithoutpains.com. Mitchell, the knee, I was so excited about this week because the knee is really the microcosm of what you do. Because it's there is a distinct difference between the pain from the muscle and the pain from the bone. And this is where it really comes down, and everybody has knee pain.
So the thing that makes the knee so different is that you live in a gravitational environment. So if you're going to do anything other than lay flat on the floor, that ability to rise, to stand, to walk, that's coming from the knee. And that's why the force requirement is so great. And in fact, why you even have a kneecap. The purpose of the kneecap is to push the force line of your quadricep away from the joint itself so it can create more force. It actually has greater leverage. That's why that's so critical. That's it. That's basically why you have a kneecap. So that kneecap joint is primarily associated with the force capacity to perform function, where the joint between the thigh bone and lower leg bone is designed for the range of motion that allows it to occur. You have to kind of know these types of things if you're going to get that right diagnosis, that interpretation of what your body is trying to tell both you and the diagnostician.
Yeah, and the thing is, too, is with Barry, and there's others out there, hundreds of thousands of others out there, you're facing surgery. I was facing surgery, and I know that feeling of hesitation, that feeling of fear. I didn't want to go under. I still don't want to go under. And my whole thing was, look, if I could try this, and if it works, I don't have to go under. I don't have to have surgery, followed by pills, because there's going to be pain. So I looked at it that way. I'm not telling everybody what to do. I'm just telling you there is an option. And the option, if you don't think anything else has worked for you, the option is Mitchell Yass and the Yass method.
So one other point I would just like to make about this concept of the X-ray or MRI. The X-ray or MRI is a snapshot in time. This is really important to understand. Let me do this, man. This is really important. This is bell-worthy stuff, okay? The MRI or X-ray is a snapshot in time, which is to say I'm taking a picture today. What is being seen may have been there 6 months ago, a year ago, maybe 10 years ago, and is not what is creating that symptom. Symptoms, on the other hand, are real time. You don't get palpitation to the heart 6 months before a heart attack or 6 months after. So understand that when we're trying to do what I'm trying to talk about, which is to interpret what your body's trying to tell me, that's real time. And that is, in fact, coming from the tissue in distress. That's why this is so absurdly unique.
So if you have pain around your knee, right? And this is what you and I talk about all the time. People come in and they say, I have pain around my knee. It's got to be my knee. That's not necessarily the case.
In fact, I've shown in more than 99% of cases the cause of pain is not where the pain is being experienced, which is why I'm always concerned about diagnostic tests being done. Always exactly where that pain is being experienced. I have found in more cases than that, 99%, the cause was not there. And you got to be looking outside of where that pain is being experienced.
And one more time, my right Achilles pain, so debilitating I couldn't walk in the morning, was actually my left glute med. My left glute med was in distress and needed to be strengthened. Think about that, everyone. It's a muscle deficit followed by muscle strengthening. That's what the Yass method is all about. What a show, huh?
It was
what
awesome. And by the way, one final bell for Matt showing up. Thank you, Matt.
Thank you, JEA Power. Thank you very much. All right, we are here every Sunday, every single Sunday on 1010XL. Woo, what a show, what a show. The Pain-Free Living Hour with Dr. Mitchell Yass, 904-906-YASS. That's how you get Mitchell Yass. Or schedule online. Live Without Pains, plural. livewithoutpains.com. Go on and schedule an appointment to see Dr. Yass and get out of pain. We will see you next week on 1010XL.